Hello, I'm Dr. Elvira Lang-Anderson. Thank you so much for having me at the Consensus Conference. I wish I could be there in person with you, but my good friend's daughter had her wedding this weekend and we couldn't leave the festivities quickly enough from USA to get to Germany in time in a state of coherence. I hope I do see many of you at the 30th anniversary meeting of the Deutsche Gesellschaft für Zahnärztliche Hypnosis. I prepared a summary here about what I will be bringing in my keynote on Friday morning and what we'll also be talking about in the Science Symposium on Saturday afternoon. Now, what has changed in dentistry since I left Germany in 1984? Well, in those days, a solo dental practice was very common. I had never heard of a German dental hygienist. Nowadays, there are intraoral scanners, there are dental dedicated CT machines, even MRI machines, 3D printing, milling machines, very sophisticated dental and cosmetic technical procedures. Well, I think you're coming closer and closer to interventional radiology, which is my background. But to afford all this equipment, you do need to have a group practice. What also has changed is that in those days, more dentists were trained in hypnosis. And they build their practice around a skill set. And now when it comes to succession planning or bringing in new staff and members to their group practice, those may not have those skills which originally made your practice flourish. So it is important to think about which level of hypnosis do you and your staff want to have, and how can we teach it, and which research supports these approaches. The thing that hasn't changed is that patients are afraid to go to the dentist. And dental anticipatory anxiety can cause patients to not show in the first place and to delay care for many years. What we also found at Tufts Dental School here is that the anxiety levels at the end of the waiting room are a very strong predictor of how much pain the patient's going to be experiencing later on the dental chair when you are going to do your procedure. In other clinical trials, we also found that anxiety prior to procedures is a predictor of adverse events, because I think patients' distress may be rubbing off on you, and in settings where drugs are given, these patients actually also will be receiving more drugs. Now, how can you address that? One thing to keep further in mind is that pain increases over time, and we found that in 3 large randomized clinical trials from the standard care groups, where we found that this increase is pretty independent of how hard you poke a patient and even how many drugs these patients receive. Now, what can you do about it? We used hypnosis, and on the OR table, or when we have very scared patients, in the MRI scanner, or we do invasive procedures on the MRI scanner, we read a script. And you can listen to the script on our free Comfort Talk Pro app. When we read these scripts, we found that this increase in pain over time, which is the red line on this graph, is not as steep. It follows the green line, which shows that it's a pretty comfortable enterprise for both the patient and also for yourself, particularly for long cases. Now you may wonder, what is the blue line? We call that empathic attention, because we felt you can't just walk to a patient who comes for dental or other procedure and say, hey, we're going to be doing some hypnosis now. It takes some advanced rapport skills for that and also avoidance of negative suggestions. So what makes the hypnosis group is just the adding of some hypnotic wording. And depending on in which environment you work, this will either be a script, or it may be a full hypnotic induction, or it may just be a few words here and there. As we sometimes do, let's say in MRI or in breast biopsies or interactions where there's very, very little time, or what your hygienist may use. For example, some things are, you may say, use all the sounds and noises in the room to deepen your own experience. So if you're ever going to start a drill, it's not going to unsettle the patient. Or you may say, well, just imagine this being a spa visit. Your body has to be here, but in your mind you can anywhere you'd rather be. You can do a formal hypnosis also. You can do glove anesthesia, or if there is a painful stimulus imminent, you can just say, you might focus on a sense of warmth or cool or delicious sense of tingling. And I tell you, nobody really knows what that is. And by the time you're done with your stimulus, the patient's still thinking about, but still feeling comfortable about it. Now, when we did the script reading, we found in these large clinical trials in the operating room, and some of you are dental surgeons, that patients had significantly less pain, less anxiety, fewer adverse effects, and they also received fewer drugs. What we also found that if we do this kind of training in the MRI setting, we can have a very positive impact on the no-show rates. And you may wonder, well, no-shows, you're only doing the techniques when the patient is there, isn't it? But what that big clinical trial showed us is word gets around in towns, and people will find out to which practices they prefer to go. And this had been the practices that we had trained in the hypnotic techniques that we now call comfort talk. MRI is also pretty similar in the anxiety creation level as is dentistry. It may be that it is medically dental induced PTSD or personally induced dentistry, but that is where we see these high levels of anxiety in both dentistry and MRI are coming from. Now, what we found in the MRI clinical trials is that also the ability of the patient to complete the procedure was significantly higher. An additional benefit was that patient satisfaction was higher after training and that was in the radiology setting. Interestingly enough, it wasn't only that there was the feeling better about it and the patients would rather recommend these sites that had been trained at a higher percentage level, but they even rated the technical abilities of the staff as higher. I thought that was pretty interesting. Now, if you want to get really, really short and just put the whole thing on an app, and we've done that at Tufts Dental School, we found that the Comfort Talk app with just listening on the average 8 minutes significantly reduced pain and anxiety. Now, as you see, there are many ways of applying the hypnotic input, and having different members on your staff apply different levels of hypnotic skill depending on the invasiveness and also the length of the procedure. And I compiled here a list of clinical trials we did along those lines under comforttalk.com/clinical trials. Also, please feel free to contact me with any questions or suggestions or some other input. On Friday, I will be talking more of how we used the different hypnotic input you can use for dissemination and training of teams and team members who provide patients with different level of invasive treatment. We're also going to be talking at the Science Symposium together with Dr. Carla Benz and Mark Jensen of what is the current state of research, and also how can you design your trials to find the right acceptance and disseminations among the target groups that are important to you. We'll also gonna discuss the challenges and the pitfalls that we all had the chance to get over with, so that you do not have to repeat the same things. Also feel free to bring your own clinical designs and we can discuss those and we can learn from each other. Thank you again so much for having me and thank you for listening. I'm so excited to be seeing more of you during the 30th anniversary of the Deutsche Gesellschaft für Zahnärztliche Hypnosis.